Hi everyone, my name is Presley. I am a pharmacy student here at the University of Utah College of Pharmacy. And today I brought on a special guest to talk to you guys a little bit about women's health and just starting this women's health campaign here at the college. We have Diane here, and I'll let you introduce yourself.
I'm Diane Bezzant Ogborn. I am a doctor of pharmacy. I practice in the community for a major community pharmacy chain here in the Salt Lake Valley. And I'm very passionate about women's health and what the community pharmacists can do to help women achieve their health goals.
Awesome. Well, I'm glad to have you here. I just wanted to ask you about some things that you see in the community and how you think pharmacists can have an impact, especially with women's health in that setting. So, as you know, Utah has implemented this new standing birth control order. And so, can you explain a little bit about that and what that means?
2 years ago in the legislative session, a bill was introduced about allowing women to have access to birth control at community pharmacies. And then the process of that rule actually being written and signed by our state medical director took some time.
Yes.
And so just this year, have the pharmacists at my practice setting been able to prescribe birth control for women who come into their pharmacy. And it's been a little bit of a process to get it rolled out, to get the pharmacists trained. Mm-hmm. And then now we're in the process of trying to advertise and let women know that this is now an option for them in Utah.
What would you say a visit would look like if a woman came into the pharmacy interested in getting birth control?
So there is a background screening form that the woman would fill out that relates to her health history, and then the visit with the pharmacist would take anywhere from 15 to maybe 20 minutes. Mm-hmm. And then depending on the results of blood pressure check and some other things during that brief visit with the pharmacist would then be able to help the woman choose a product that would work for her and then fill that order for that patient.
That's very cool. And so when you say, they're screened in the pharmacy, they got approved, would they be able to walk away from that visit with birth control in their hand? Or
Absolutely.
Okay.
Absolutely. So it could very well be come in, mm-hmm. talk to the pharmacist, complete that screening form, and leave the pharmacy with birth control pills. Yeah.
That's really cool. That's a really cool thing because usually it's associated with a provider visit, and then you have an exam, and I know that can be stressful for women, especially women maybe who've been on birth control for a while and just need a new prescription, I guess.
So one of the reasons I'm really excited about that is as a community pharmacist, I do see women coming in to get Plan B. And so this could help women that are needing emergency birth control. And also I've had women come into the pharmacy that were somewhat distressed because they were out of refills on their birth control medication and were not able to either connect with a provider to prescribe for them or were denied because they hadn't been able to get in for a visit. And so this could easily fill that role for many women.
I think it's cool that, even just knowing your local pharmacist can tell you about these things is awesome. And even if you aren't going in for birth control, just knowing what a valuable resource your community pharmacist is. So outside of birth control and prescribing, what are some things that you love to do and love about your job and working with your patients? And what resources can you provide for your patients?
So a community pharmacist can provide excellent counseling on medications, their use, their time to effectiveness, what to expect, what side effects to look out for. We try and screen our patients to see if they are up to date on their adult immunizations. And HPV vaccination is something that I feel like is undervalued in Utah, and that there are a lot of individuals that could benefit from vaccination with HPV vaccination and then reducing rates of HPV cancers in the adult population in Utah.
Can you explain what HPV is and why we're so concerned about it and why the vaccine is awesome?
So HPV is human papilloma virus, and there are many strains and types of human papilloma virus. Some cause cervical cancer, genital warts, oral pharyngeal cancers, anal cancers, penile cancers, and none of those are anything that anybody wants to get, that they want a family member
Yeah.
to contract. There's a great vaccine for HPV cancers, or to prevent 9 strains of HPV. Children and adolescents are immunized for a lot of things, but they're not immunized by law for HPV. And so there's a lower uptake of the immunization. But there are a lot of HPV cancers. Adult women will get checked for cervical cancer their whole life. It makes a lot of sense to, hey, how about we get immunized for those HPV virus strains?
Do you think there's a hesitancy with parents in this vaccine? I know some of the things I've heard is like, my kid is not sexually active. You know, they're not at risk right now. What would you say to a parent who is not necessarily convinced that their child would benefit from something like this at that age, or, you know, when they're younger?
I believe every parent wants their child to be sexually active at some point in their life, because that's part of being a healthy human. And so having children immunized before they're sexually active is a great idea. Kids or adolescents are at a good time to get immunized for a lot of things, and we do want to protect our kids from all types of germs, viruses and bacteria, but we can't. And we can't protect them from all types of cancer, but we sure can protect them from a few types. And so we do it.
Well, it was great to have you on, Diane, and I'm sure that our viewers will appreciate just your insight as a pharmacist and one of, you know, your most accessible healthcare professionals. And I think it's great that you came and spent some time and educating. So thank you.
My pleasure, Presley, and I'm excited to see you as you become a full-fledged pharmacist.
Thank you. Thank you so much.